Yes, that is her skin peeling off her face. Oh, she looks good. Phenol peels. Are they satisfying or is it disgusting to watch the skin get peeled off a patient's face?
Oh, you nasty.
Let's get into it. So you can see she's got some acne scarring, and this is probably from when she was an adolescent. And these are like ice pick acne scars, and now she's been peeled, and there goes her skin. Wow. Well, she's happy. Look how red her face is. Is there a filter? I think there's a filter. Phenol peels are considered to be deep chemical peels. Now, chemical peels can come in light, moderate, and deep. Light chemical peels are basically lunchtime peels, where we put an acid on the skin like a glycolic acid. It causes the upper layer of skin cells to slough off, and then afterwards you may feel a little bit and see a little bit of skin that peels, but otherwise usually you just go right back to work or to your activities afterwards. Moderate depth chemical peels go a bit deeper. The most common moderate depth chemical peel is a TCA peel, and these peels will usually cause your skin to basically flake off and peel off for up to 7 to 10 days. The deep chemical peels, like the phenol peel, can take a couple of weeks for the treatment to actually heal. And these peels go very deep into the skin, creating all of that redness that you're seeing. Oh, look at that. So that is her actual skin that they're peeling off of her face. Wow, it looks like they didn't even do the lower face, just her cheeks and her forehead. Let's see how she looks. Pretty good. But is there a filter? Let me know if you think there's a filter. Phenol peels started way back in the 1920s, and really they're not practiced all that often here in the United States anymore. The main concern that we have with phenol peels, and why most doctors like myself don't perform these procedures, is because they're dangerous. You can actually die from an improperly performed phenol peel. Now, phenol is otherwise known as carbolic acid, and this is an acid or a poison that we literally will put then on the surface of the skin. That acid will basically disintegrate or destroy the upper layer of skin cells, and if you treat it in a certain manner, you can get that acid to go to a certain depth to where you can actually then smooth out wrinkles, you can smooth out acne scarring, but not go so deep as to cause actual scarring on the surface. Here we go. Look at that. So that is that phenol mask of skin. And the skin underneath it is new skin. You can see how red it is. That redness can persist for many, many weeks, even a couple of months. So why is a phenol peel dangerous? Well, basically phenol, like I mentioned, is a poison, and it's poison that you put on your skin. Now, technically your liver will neutralize the poison, and then your kidneys will excrete it. But it can only excrete and neutralize so much of the poison at a time. And for this reason, we usually will recommend doing phenol peels a quadrant of the face at a time. So you do basically the upper quadrant of the face first, then you give it a good 15 to 30 minutes, then you do the next quadrant, and then the final quadrant. This means that it can take upwards of an hour or even 2 hours to do a full phenol peel over the whole face. Now, what happens if you, let's say, just go and peel the whole face at one time? Well, if you overload your body with this phenol, this carbolic acid, your heart can undergo arrhythmias. It can get an irregular heartbeat due to the poison in your bloodstream, and technically, you can die. So now we're going to actually look at somebody, and he just had the peel done. It looks like he's heading home. And now watch as that peel healing progresses. You can see his skin is getting harder. Now during this time, he's not going to want to make real extreme facial expressions because you do want that skin to harden into a mask so that it can heal underneath it. A lot of times patients will put Aquaphor over that skin to keep it relatively moist, and here they are going ahead and taking that skin off. How satisfying? Is it satisfying, do you think, or is it gross? Now, one study showed that there is a 6.6% chance of getting a cardiac arrhythmia when you get a phenol peel. And the other thing to consider with phenol peels is that there is quite a bit of recovery involved. As you can see, for a good 2 weeks or so, you've got that mask of skin on your face, and you're not going to want to go out in public looking like that. And then your skin is really, really red afterwards, and that can take several months to completely completely settle down. So because of this, phenol peels should really only be safe for people who have really severe sun-damaged skin or really severe acne scarring, because unfortunately less invasive treatments, especially for acne scarring, may not be effective enough to give the patient the result that they're looking for. So what can you do if you want to see some results, but maybe you don't want to do a phenol peel? Well, fractional lasers are a reasonable option, and if you undergo a number of those fractional lasers, you may be able to get similar to what you can get from one phenol peel. Ablative lasers, where you literally laser all the skin off of your face, also is an alternative to phenol peels, but that too is a pretty hefty and difficult recovery. And another option is to do a series of moderate depth chemical peels. Let's look at one right now. So as you can see, this patient's got skin that is starting to peel off from her moderate depth chemical peel. And most likely this peel was done anywhere from 4 to 7 days prior. Now you got to be very careful when you're cutting this skin off, because you only want to cut off skin that has actually completely separated itself from the underlying skin. And obviously you don't want to cut yourself when you do this. And usually this is something we do in the office. So in my office, I don't do phenol peels, we do TCA moderate depth chemical peels. The one we do is called the controlled depth peel. This is very safe. You get peeling like you just saw in that woman. And if you do a series of them, you can see a really significant change in the smoothness of the skin, in age spots, in fine lines and wrinkles, and the overall texture of the skin. And unlike a phenol peel, you don't have redness that lasts weeks and weeks and even months. Well, if you found those phenol peel videos satisfying, take a peek at this video right up here where I show you some ones that are even more extreme, where that skin is getting lifted off the face and you just cannot believe these results. Take a peek at it right up here, and as always, remember to eat real food, use clean skincare, and auto-rejuvenate before you operate.